A 35-year-old repeat offender was arrested and charged with practicing dentistry without a license and fraud. Don't bargain shop when you're looking around to have a cosmetic procedure. Just don't. The price you end up paying could include paying with your life.
An Indianapolis woman is dead after traveling to the Dominican Republic for plastic surgery.
A Houston mother is sharing her heartbreaking story after losing her daughter to fungal meningitis. She has a message and a warning to anyone hoping to save money by traveling across the border for surgery.
Let me explain to you why. The practice of medicine is not transparent and it's not efficient. It's not an industry where you get what you pay for. For instance, an MRI done at an outpatient radiology center that's certified, legit, board certified doctors looking at the films, that MRI might cost you $400, $500, $600 cash. If you were to go to a hospital and go through your insurance, the bill might be $5,000, $10,000, even $20,000 for exactly the same study to deliver exactly the same information. But that's not always the case. It's not always a case of you get what you pay for. And when something seems too good to be true, it usually is. Our moms were right. Everyone loves a bargain, but this one could cost you your life. I saw a story on the local news this week here in Tampa Bay, where a 35-year-old repeat offender was arrested and charged with practicing dentistry without a license and fraud.
A warning tonight from a Tampa dentist. Make sure the dentist you use has a proper license.
Yeah, good advice. The warning comes as a woman faces criminal charges for illegally giving her clients veneers.
She was offering a mouthful of veneers, that beautiful, perfect white smile, for $3,000. A local dentist would probably charge plus or minus $1,000 per tooth. So how is she able to do it for $3,000 for the full set? Let's look at her cost reduction strategies. One cost saver was she was operating out of what she called her beauty bar. It was a nail salon. Another way that she saved money was attaching the veneers to your teeth. She was using nail glue or super glue. One more thing, she offered to do the whole mouth in a single sitting in a single day. I will tell you that dentists take at least one and usually multiple weeks to do your full smile. There are so many things to consider. It's not just how your teeth look, it's how they fit together. It's how they work when they chew. There's so much more to know, and you can't do it in a single setting, in a single day, in a nail salon, in a strip mall, using super glue. Ain't gonna happen. Here's the really sad part. It would have been so easy for these victims to spot the risk had they done even a little bit of research. You know, after the story came out, I did a single Google search about the beauty bar and about this woman who was holding herself out as a veneer tech. Number two, I found a story from an adjacent county where she was charged with exactly the same thing about 7 months earlier. Number three, I found Yelp reviews, which were a pile of 1 stars. And the 1-star reviews were mostly about how the nail techniques were not sterile and aseptic. They never washed their hands. They used the same instruments from hand to hand. All sorts of things about the sterile technique used for acrylic nails. What do you think is going to change when she's working in your mouth all day, putting these veneers in place with super glue? There were all these red flags to be found, and unfortunately, these victims didn't do their research. And I'm not blaming the victims, I'm not. But you know, there was actually a story done by a different news agency locally. They specifically looked at her location because somebody complained, and they uncovered all of these problems months ago.
Investigative reporter Brittany Muller first dug into this case 7 months ago. She joins us now live in studio with an update. What a story, Brittany.
So the warning signs were there, but the research wasn't apparently done. What has me really cranked up about this is that more and more these folks who hold themselves out as veneer techs, they're popping up on social media and promising these miraculous smile makeovers. But don't do it. It's not worth it. The folks that were highlighted in this local story that led to her arrest, they're now dealing with infections. They're dealing with complications. They're dealing with damage done to the teeth. They are having to pay 2, 3, 4 times what it should have cost at a reputable dentist's office to be done. And it could have been a whole lot worse. It could have been costing them their lives. I get it. You only live once. You want to live your best life, but we only have one life, and we have to make smart choices. Now, yes, it's easy to overpay. In medicine, like I told you about the MRI, a couple hundred versus a couple $1,000s. It's easy to fall into that. But when something seems this unusual, a low price, done in a strip mall, done in a hotel room, the stories are endless about these kind of scam artists. Don't fall for it. Over the next few weeks, I'm actually going to do a series of videos that are right on this same topic, but I'll share different perspectives about it. I started this YouTube channel to help you as patients become advocates. My goal is to help you learn to be an advocate for yourself, for your loved ones, for your family members, as you navigate through a very complex and not transparent healthcare system. I want you to be safe in every step of the way. I will be bringing you stories of physicians who are licensed and board certified, but are they doing procedures that they maybe shouldn't be doing? Not that many years ago, when I was still delivering babies, there was a patient that went in to have a breast augmentation. The procedure was being done in the doctor's office. The doctor was not an MD or a DO. The doctor was a dentist. He graduated from dental school in Missouri. He did a fellowship on maxillofacial surgery, which made him an expert from the collarbone up. Why was he doing not only a breast augmentation, but liposuction? He was also managing his own anesthesia, which he didn't do a very good job with. He ended up overdosing her with propofol. That's the same drug overdose that Michael Jackson died from. Her dose was 5 times the normal limit. She went into a coma. He called for help. Nobody could help her at this point. Could he take her to a hospital? Yeah, but he didn't have hospital privileges. She ended up dying a couple of months later, and it's a really sad story. His license was eventually suspended by the state of Florida. 2 days later, it was actually revoked. He was already practicing in another state, and he's still practicing today. There's a lot of bad stories to be had out there. There's a lot of traps to fall into. The Kaiser Family Foundation has a news organization, KFF Healthcare News. They teamed up with NBC News and they did a very compelling report about dangers of cosmetic surgery centers where there's more contact with the sales team than there is with the medical team. And there's more emphasis put on selling procedures and upselling procedures than there is on policing who's doing the actual work. The bottom line is that I want you to stay safe. And there are important questions that we have to answer. How do I keep myself safe? How do I know that my doctor is safe? And how do I know that my doctor, who might be board certified, has the skills to do the case that I'm asking her or him to do? The bottom line is you need to know, what questions should I be asking? The story and all of these are linked in the description, so please check out the articles. While you're there, hit like, hit subscribe, hit notify, all the usual stuff. I want you to start learning about this because over the next couple of weeks, we're going to be talking about some really tough situations that actually took place, and patients were harmed and patients have died because they weren't asking the right questions and they didn't end up in the right hands. I always say we have to take care of ourselves if we're going to take care of others, and that's exactly what I want to do with you as my advocates as we move forward. I'll see you again soon.